Good afternoon. I'm Dr. Amy Thompson, and I'm so glad that you've joined us today on this topic of breastfeeding and lactation support. So just a few things at the beginning. So as a reminder, the information provided during this event is for educational purposes only. It is not intended, nor is it is implied to be a substitute for professional medical advice. So always consult your healthcare provider to determine the appropriateness of the information for your own situation. If you have any questions regarding medical conditions or treatments, please consult your physician. Participating in this event with this clinician does not create a physician-patient relationship. So I'm so excited to have this today. So I want to join me in introducing Rebecca Metter. I call her Becky, so I am privileged that she works here with me at the Covenant Children's Hospital. She is a nurse and she's a lactation specialist that works here at my hospital. I was joking with her before this. She will not say this, but I'm telling you, this woman knows more about all of this topic than anyone I've ever met. So you guys are in for a treat. So Becky, I always love this question since I already know you, but tell us a little bit about your role at Covenant and what it is that you do on a daily basis. And then talk to me a little bit about what inspired you to do what you do with your life.
Okay. I coordinate the lactation, the parent education service. So here, we have a group of about 8 women. There's 5 positions. Several are on call and several of us are full-time as well. We coordinate and do the parent education classes, which includes like the infant CPR, the breastfeeding, the labor and delivery, multiple things that way. We have sibling tours and adult tours as well, which are a little bit on hold right now, but we're starting to get back into things. And we do daily rounds on all of our patients every day. And we are here to assist the mom, baby, labor and delivery, antepartum nurses with all of the lactation services. So we see patients every day.
Yeah.
As far as my background and why I ended up in this position, I was a pediatric nurse straight out of nursing school. And when I got pregnant with my first child, I was, aware of all of the different things that go on in pediatric floors and things. I really looked at what I was going to do as far as my feeding preference, my choice on that. Read everything I could on breastfeeding, formula feeding, all of that. And that was when I realized, due to, I have a family history of allergies, that I got really interested in the breastfeeding and learned as much as I could. And then worked for a pediatrician for a part-time and on the pediatric floor, and then ended up doing the classes here and then just growing into the coordinator position.
That's awesome. You've done a great job for us. So my understanding is this August is National Breastfeeding Month. And so it's kind of a month that we want to bring a highlight, to breastfeeding and lactation and those services. So I was a breastfeeding mom, and I, like you, I actually had a mom who did not breastfeed. And so she was very supportive of me, but really I didn't have a lot of, knowledge. So talk to new moms and say, so for new moms that are, that are breastfeeding or thinking about breastfeeding, like what are things that you would consider like normal? Like what are things that they're going to run into that are just part of this?
It's a learning curve, just like everything else. And I think that probably if you can get a good baseline education before you start, because a lot of people come in and they're like, oh yeah, I'm going to breastfeed, but they really haven't done any kind of education or research on it to, have a baseline of what to expect. So that's the first thing that I would say is they need to do that, is to get that baseline going. It requires a whole lot of patience usually and a whole lot of persistence. And it's one of those things that you just have to say, yes, this is what I want to do. And if you have a desire, you need to really give it a couple of weeks. So don't anticipate that it's always going to be easy or it's always going to be hard. For some people, it's the easiest thing in the world. And for others, it's probably the hardest thing in the world. And then there's a lot of normal in between. So just anticipate that it is a learning curve and that you just have to be really patient to be able to be successful, and give it a couple of weeks.
Yeah, that's great advice. I have 2 sons, and I breastfed both of my sons, and whom I had first, like latched on the first time. It didn't hurt. Everything was beautiful. But I always say if I had had JJ first, because JJ was very difficult to breastfeed, we did it successfully. But I think to your point, like if I had had JJ first, I hope I would have had someone like you to say,
Yeah.
give it
And
some time.
that's exactly right. And I tell moms all the time, I wish that I'd had me whenever I had my first child.
Mhm.
I really had it fairly easy compared to most moms, but it's some of the typical things that we do see. It'll be, like a first time mom that was really easy. The second time it was easy. The third one, all of a sudden, it's really hard. And it's very discouraging because you think if you've already done it, successfully long term with two babies, that it's going to be like that. And that's not always the case. Every mom and every baby is different. And that's why every day is different for us, for all of the lactation specialists, because you never see identical. It's always a different personality and a different dyad. So you just have to kind of, be real patient and go with it, whatever you get, and do the best you can.
So what are some of the challenges that you often encounter with moms that are breastfeeding?
Probably one of the biggest ones is there enough milk? There's so many people that just, they, first of all, they don't understand the colostrum phase versus when the milk comes in and the volume issue with it. And they really don't understand that breast milk is not just nutrition, it's like medicine too. It's a combination piece of it. And the colostrum is like very small amounts. The baby's tummy is small. But that's one of the hurdles that we have to get over with the moms, is for them to understand, and trust their bodies and trust the babies, and then have us there to guide them if we feel like the baby's really not getting enough, and troubleshoot for them. The second is probably the latch. Just, if it's not comfortable in the very beginning, you have to kind of tweak that. And a lot of people are afraid to ask for help. So, that you should and it's kind of a private thing. It's not something that you don't, you feel real comfortable a lot of times, but it sure is worth the time sometimes, because it can be a very simple fix, that we can help with that piece. And then I would say probably the third thing, the engorgement part. When the milk comes in, it can catch you off guard, and it can be really a very, very difficult, hard thing to get over. But again, if you ask for help, then, we can give you the suggestions and hopefully remedy that, for you pretty quickly. So.
And so, if you have a mom who is struggling with some of these things, like when is it that you suggest that they start to reach out for help? And then talk a little bit about what happens after you go home? Because I think a lot of folks feel very comfortable reaching out while they're in the hospital. So kind of talk about the timing of when you think that should happen, how you do that when you're out.
Well, I feel like we're very fortunate here because we are able to check on our moms every day. So it build that rapport, which makes it a little bit easier to reach out. There are some people that don't need help, and, I respect that totally. But I think that in the very beginning, if you have questions, you need to reach out. In the hospital, if you are uncomfortable or you are concerned that your baby is not doing well, don't be embarrassed or afraid to reach out to have somebody just do a quick evaluation. And then absolutely, when you get home, if things are not falling in place and you have that baby that isn't satisfied or it's not having adequate output, the weight gain is one issue. Definitely, if your baby is not gaining weight according to, we'll give them some guidelines on that, then you definitely need to reach out and get help. Right now we're doing a whole lot of phone calls, since we're not doing outpatient, but typically follow-up phone calls and making sure that they have a phone number where they can call. And there's besides just reaching out to the hospital, to us, there's other services that are in the community. I mean, there's WIC clinics, there's the La Leche League, there's people that actually have doulas that can help them, and then there's private lactation consultants as well. So there's many opportunities, to reach out, and it's worth their time and their trouble. It can really make it easier than trying to, tough through it.
Yeah, I agree. And, I was talking about how, I breastfed my first, son, and my mother had not breastfed. And so one of the things that someone encouraged me to do was, irrespective of how hard it was, or how easy it was, to just get your lactation specialist to come by and watch a feeding and see how you're doing. And it was invaluable to me.
Yes.
And like I said, Rowan was easy, but it was invaluable when they came by and said, "It's great. He's latching well." It's and to show me what to look for. So I would encourage you, while you're in the hospital, take advantage of the personnel that you have. And then I would echo your sentiment that once you get home, man, there's so many resources that you can do. So what about things like like support groups and stuff, and so for these moms, how do you think they help, and how do you get in touch with one of those?
The advantages of having that support afterwards is that you learn so much from other mothers. It's amazing. We've had a support group for a long time, and we used to have a whole lot more people now than we, with the media the way that it is, and they can get the information.
Yeah.
Actual sitting and talking to a mom that is going through the same things that you are, it's invaluable, and you learn so much, and especially in a support group where you have different ages, like you've got babies that are 9 months old, and then you have a baby that is a 2 week old. Those mothers, they learn all the tricks and trades from each other. Plus, you've got the support, and you realize, oh, she had the same issue that I did, or I'm really fortunate because this is easy for me. I'm one of those ones that got that easy baby that latched on, and it was not a problem. So you learn to appreciate, but also build bonds. We've actually had from some of the support groups play groups that they have developed later on their own, that we don't do. And I think that especially if you move to a new community and you don't know anybody, it's a perfect place to meet somebody and to support each other, in your endeavors, with it.
I agree. I think that's great. I certainly, we had some, I know my son just went to college this year, but we actually did have some, ability to get on the internet and social media, or even back in those days. And so I know that we were part of a group, and even some of the things that we were able to find online. So if you're at home and you're struggling with, some of those issues, make sure to try to get on and look for either a support group or some of those things.
And the other piece of that is, if you're fortunate enough that wherever you live that you have access to outpatient services, then that, especially people that are having trouble with the latch after they get home, it's worse, than it was. It's not improving, or a weight gain issue. Those are perfect opportunities for that hands-on help that you can get. And it's really hard to do if it's not in person, to be able to kind of show. So if your community has that, I would highly encourage. Not everybody needs an outpatient appointment or a visit, but if you're struggling, then definitely that's something to see if it's available.
And it was crazy to me with my second son that, kind of struggled with breastfeeding. I did get that in-person, consultation. And they just changed the way that I was holding JJ, and everything changed. It was amazing to me that I never would have thought of what it is that they thought of, and how they told me to position him, and then he was doing great.
It's like I tell a lot of moms, I'm going to show you my tricks. That's what it is. You just need to know, and you just need to tweak it a little bit. And they're like, oh my gosh, even the way that you sit, is in position the pillows, it can make all the difference in the world. And a lot of very simple, easy, techniques, and you just need somebody to show you.
Yeah, I agree. So, the topic that we cannot get around, Becky, on anything that I'm doing on Facebook these days is the COVID. So the COVID-19. And so talk to me about, has anything changed, with your recommendations, or what you're doing with new moms with COVID?
I mean, with the COVID piece of it, I mean, I think what we've noticed more than anything is the anxiety, that everybody's experiencing. But then if you're pregnant and you have a new baby, we've gotten multiple calls, asking about that. Recommendation now is, to continue to breastfeed. And, you're giving your baby that extra protection about everything, and hopefully COVID too. So if it's just like everything else, wash your hands. If we have a COVID positive mom, then originally the recommendation was to separate the mom and the baby, but to have the mom to still continue to pump and give the milk. Now recently, that recommendation has changed, and we can actually keep the moms and the babies together. When the mom is at home with a COVID, when the mom is COVID, then you're just going to make sure to remind her and instruct her that she needs to do meticulous hand washing. She needs to wear a mask and feed her baby, or she can pump and use, meticulous technique with her pumping equipment too. But feed her baby and then do the distancing, and have a caregiver, a healthy caregiver, family member, friend that's there able to take care of the baby. But, at this point, that's what's happening. We're recommending, and we're having good results with it so far. Now, Amy, I mean, everything changes from day to day. We do our best, to keep up with what's going on in the world and all of the different recommendations, everything. And we just have to go with the best, evidence that we have available at this time. But we try really hard to encourage the moms, but we are seeing some anxiety with all of this, the uncertainty. And I can understand it. And we get phone calls from moms before they deliver. They're concerned about it, wanting to know what to do. And we just tell them, be as careful as you can, do your social distancing before, especially that last month before you're coming to the hospital. And, hopefully that's going to help to decrease the amount of moms that are positive at their delivery time if they, follow those recommendations.
I agree. And, you know this, since you work with me here in the hospital, but here at the Children's Hospital, we have seen a lot of asymptomatic pregnant women testing when they come in that are positive, for COVID. And so your hospital that you're at, if you're watching this, will be the same way. We've got great techniques. All my folks on labor and delivery and mom baby and our lactation folks know exactly how to take care of those patients. And like Becky said, we used to, the American Academy of Pediatrics suggested separating that. I think we've only had one in the early days when we thought that that's, or when we knew that that's what the recommendations required. Everybody else, we've been able to keep those babies together. And I think the moms have done really great.
Yeah. And they just need a little extra TLC. I think that, you come in and they catch, and when you think you're fine, you feel fine, and then you find out you're positive. It's really hard for those moms, to have to do that. And I admire all of them, and, I encourage them all to breastfeed. If that was their plan, that was their goal, and that's what they wanted to do, then don't let that get in their way.
I agree. And I would encourage you, if you're a mom out there that's watching, make sure you're talking to your OBGYN. Like Becky said, some of the recommendations are changing. I literally spoke last week to a group of folks in Lubbock talking about back to school. And, everything that we were reading is that younger kids, aren't, really active in transmission. And then I say this, and like literally today, there was an article that came out in the pediatrics journal that is actually like, hey, just kidding. We actually think kids have these, high viral loads and can transmit. And I would just say that part of the thing that comes with anxiety is the fact that data is changing, all the time as we learn stuff, about COVID. And the very best thing for you to do is to keep talking to your physicians. I read every day to make sure that nothing has changed, to think about treating my patients. So just make sure you continue to touch base with your physician. So Becca, we have had a lot of questions about like on the breast, with the breastfeeding. If you have a COVID positive mom, can't you transfer the virus to the infant in breastfeeding?
And remember, nothing is 100%. We don't have all of this in, but everything that has come across my desk that we've been looking at and then we've read is that we haven't seen any positive piece of that going. I think that there's been a few things, little, like maybe in China, there was one article about, something, but it wasn't anything that was definitive. We haven't seen any of that so far. So
I agree. And what I've looked at shows, moms are not transmitting, across the placenta, to
right.
baby. So if you get, COVID and you're pregnant, there's been, no transmission, to the baby before birth. And then certainly in the transmission that has happened after birth, those numbers have been very low. And they probably think it's what you and I were discussing, that it's actually probably, if the mom is holding the baby, and potentially maybe not masking, or if they don't weeks, more than we've seen anything that would, breast milk. My understanding as a pediatrician, because the thing I'm always encouraging, moms to do is the very best thing that they can do is breastfeed, especially when they're sick, because then they're making bodies and giving those to the baby.
Yeah, it just makes sense that our bodies, because that's how it works, the protective mechanisms. So
I agree.
We'll just keep following the data till they tell us to do something, if there's something else we need to do better.
I agree. So, let's talk about, there is a part of the population that, even with lactation support and even with things like this, finds themselves unable to breastfeed, or they have, other things that preclude them, from breastfeeding. And
Right.
you know about this before, that, man, we are huge encouragers of breastfeeding. We think it's best. I mean, we think all of those things. It's also true that if you're out there and you're watching and like you just have not been able to make this work, and things have not worked for you, I always point out to people that my mother did not breastfeed me. This is back in the 70s when she said I did what the pediatrician said, and we were formula feeding, and I always joke with them that you can decide if you think I turned out okay after that. But this really is a concern, and so like while we're talking about breastfeeding, talk a little bit about formula. And so if someone finds themselves in that situation, what do you suggest? What kind of things?
Right. I don't think any mom should feel guilty, first of all, about whatever their decision is. I think it's a real personal decision. I always encourage them to do their education and make an educated decision. But there are definitely situations where it's not the safest, thing to do. And we always try very hard to respect that mom's decision. And support her in whatever, she needs to do. As far as which formula, that's what I get asked that a whole lot. That I always defer that to the pediatrician. There's basic formulas, and then there's the specialty formulas. And so that's something that the pediatrician should guide them on. But definitely there's, that is a situation that is there. And we do, encourage moms to try to, educate, make the right decision. But, there's reasons like medications, like they've done everything they can possibly do to get their baby to breastfeed, but they don't, there's some sort of a, anatomy issue that's really preventing it. And I would never want a mother to ever feel really bad. And that's one reason why the mothers that do desire, to try to get them to give it a couple of weeks, because at a couple of weeks, it's kind of like, okay, I can do this, or no, this is really not working for me, because I don't want them to feel guilty about their decision, and because everybody's doing the best they can for their babies.
I agree. And I would echo, obviously I am a pediatrician, but I would echo that talk to your pediatrician about the specific type of formula. All the formulas that we have available to us, that you can buy in the supermarket that are available to you, they're all good. The difference is some of the additives, and, like if, some of the added rice, you'll see all this stuff in these different things. Let your pediatrician talk with you about which one of those formulas, is the best for you. Some of those formulas have, more calories, less calories, different things for preemie rice. And that's really a decision that you need to make with your pediatrician. But Becky, I echo the thing that you say, that if you're out there and you have just not been able to breastfeed, or if your physician is giving you a reason that you can't breastfeed, I say we're very, very blessed to live in the year 2020, where I think the formulas are very good. And if you'll notice all the time, when they figure out some of the things that, breast milk contains, you'll see that, when we're able to kind of make those and add those to infant formulas. And so they've been able to really improve infant formulas.
And one thing I want to add to the formula piece that's important that a lot of people don't realize, they really need to know how to mix their formulas correctly, because I can remember from my days as a pediatric nurse, babies coming into the hospital because it was not mixed correctly. It's very important to follow the directions, read the directions on the can, know all of the specifics about it. And you should get information on that in the hospital before you leave. And, you can always call and ask questions, but that's real important.
I agree with that. So I always want to ask a question. Nobody wants to leave out the dad. So if we have dads that are watching, what are ways that new dads can get involved? And I know that this was a question, my husband had, breastfeeding is sometimes there's dads that actually like the idea of formula feeding because, they can hold the baby or they can do these things. So what suggestions would you give for dads whose the wife is breastfeeding?
The moms that are probably the most successful have dads that are supportive. It really is important, and just for them to be on board, for them to value what they are doing and realize the health benefits for mom and for baby. I think dads burp a whole lot better than moms burp. I mean, I don't know why, but it works that way. But dads can do skin to skin with babies for comfort and give moms the break with that piece of it. I mean, anything that they can do as far as the diapering, the nurturing, and all that. And the bottle issue, as far as wanting to help feed and everything, I mean, the pumps are so good now. It's that, in a few weeks, that moms can have plenty of milk pumped, typically for them to help with those feedings and maybe let mom go to sleep a little bit earlier. There's ways that you can coordinate that. But dads or even grandmas or whoever that support person is, they do not realize how important it is that they keep, telling them how good a job they're doing, asking what they can do to help. I mean, I have some of the dads here, they're great at putting, getting the mom situated, getting the baby over there, and they've got it all set up before I even want. So they are very, very important. It's a family. It's the three people. It doesn't take just one. It takes the mom, the dad, and the baby.
I agree with that. And, if you're, if you're out there and you are, the dad, the significant other, the grandma, anybody who is that support person, there is a role that you play, and you can bond with that baby, even without being the one who's breastfeeding. And my favorite thing with my husband was that 2 a.m. feeding. And and he would go get my babies, and like you said, I would get myself set up, and he was able to participate, in that. So I love that advice. So we're almost done and almost out of time. So if you wanted to just give one piece of advice to new moms on breastfeeding, what would be the thing that you would say to them?
It's really hard to just have one. I think you need to get your baseline education. I think that you need to make up your mind that this is what you want to do and not expect it to be perfect. And again, you have to have patience and you have to be persistent and, give it that couple of weeks. And then I feel like you're going to feel really good about your decision.
Yeah, I agree. And I'm really thankful that I was able to be able to breastfeed both of my boys. They make all kinds of, stuff now where I remember I went into the breastfeeding, they have a breastfeeding store here and, breastfeeding store. And like, they helped me figure out how to pump on my way to work, which my husband thought that this was the funniest thing ever. But man, I loved it because I could pump. And when I walked into work, I knew that the clock was, just starting then. But even so much good advice from the folks, who were even in the store. And so there's so much out there. There's so much written. There's so much support. So we just want to encourage you. We do think breastfeeding is best as a pediatrician. I certainly encourage it. But know that if you can't, there are super good alternatives with formula feeding. And we're raising, healthy kids like this. Thank you so much for joining us and sharing some of your knowledge about breastfeeding and stuff. It's been a pleasure to have you on the show and let these folks know you. So keep up the good work with what you're doing with our patients.
Okay. Thank you.
Okay. Thank you, guys.